Greetings, well-beings. I am so excited to get into House MD. We compiled some of the best clips from the show just to get a reaction to talk about what they're really doing or saying and how kind House MD can be. He's pretty funny, I'll admit it. Let's get into it.
You're going to give me the drugs for the toxo only. You're going to test me for HIV under a false name. You are going to test me for cancer and anything else that could have done this to me. If I have cancer, I will deal with it. But I do not have AIDS.
Wow, that was a really great moment. It was wild. He's like, but I do not have AIDS. And he wants to be tested in another name because there's so much stigma around being sick. Honestly, whether it's HIV, cancer, or depression, there's so much stigma around being sick or having a label. And that really sucks. But I'm going to take a moment here to tell you guys a little bit about AIDS. Dr. Khan, why are you talking to us about HIV? Prevalence is actually the way we use how many people live with the disease. And HIV is prevalent in 1.2 million people in the United States. To put it in relatable terms, about 1 in every 250 to 300 people has HIV. That's pretty common.
No pills.
What's going on?
The antiretrovirals aren't working.
Why not?
Because you don't have AIDS. First test was a false positive. Happens one time in every 5,000.
Each medical test has 4 possible outcomes: true positive, true negative, false positive, or false negative. Now we're entering biostatistics for dummies, but it's actually really interesting. I thought it was super fascinating in med school. No test is perfect, and all of them are built based off of how sensitive or how specific they are. The classic mnemonic used in medical evidence-based decision-making is SPIN, and you can think of these 2 words as the behavior of a test. A highly specific test rules in a disease, which means it has very low false. So the highly specific a test, the more likely the person has the disease if they test positive. Now let's talk about SNOUT. SN is for sensitivity and OUT is for ruling out. If a test has a really high sensitivity, you can almost relax when it comes back negative because you certainly don't have the condition. It produces very few false negatives. It's kind of fun because in med school, learning about statistics and the logic behind why we use certain tests was awesome.
You ran a second test.
Yeah. You're still dying. The only difference is now we don't know why.
Kidney and liver cysts are both benign, and lymph nodes all came back clean.
His left armpit node has antibodies for CV11.
Well, not enough to indicate lymphoma.
We never tested for hairy cell leukemia.
No, but we would have picked it up somewhere else besides one lymph node.
And his spleen isn't enlarged.
Size isn't everything.
I think one of them is an
mother lode
oncologist.
for
or
hairy
immunologist.
cells.
I think House is supposed to be an immunologist.
Let's cut it open.
You can't biopsy his spleen, it'll bleed like steak.
The reason why I said that is because the spleen is responsible for the immune system. They're talking about hairy cells. Hairy cells are fascinating. So I feel like I should explain what this is. Hairy cells are abnormal B lymphocytes, like a white blood cell with long, thin hair-like projections that look like hair under the microscope, of course. And they're cancerous cells, and they're associated with a rare, slow blood cancer called hairy cell leukemia. And the production of these cells can outcrowd the normal cells, leading to immunodeficiency and multiple sicknesses.
Positive for Epstein-Barr.
So what? Doesn't point to hairy cell. It's irrelevant.
So he just talked about Epstein-Barr virus. And do you know how much of the population has Epstein-Barr virus? 90 to 95% of people have been exposed to EBV. In other words, nearly all of us have it. But if someone gets a stress reaction or a different illness, that EBV can cause disease. There are certain infections that can cause cancer, and EBV is one of them. It can cause Burkitt lymphoma, and hepatitis C is another virus that can cause hepatocellular cancer. Most of the time, we don't really know what causes cancer, but I think it's great to have a list of what infections can cause cancer. That way you can prevent yourself from getting those infections. Most common, most preventable is HPV, human papillomavirus. They've actually developed a vaccine, and I recommend all younger people from age 16 to I think 30 or 32 should get HPV vaccines. HPV is silent, but in women it can cause cervical cancer. It's an infection and it's totally preventable. And I actually unfortunately lost a friend in high school. Like she died in her early 30s. She contracted the virus.
You had an epileptic seizure. That's how you bit your tongue.
I haven't had a seizure since I...
What medication
He
did you
bit
take?
his tongue, and House is playing super detective right now.
No seizure since I was 6. No drugs.
He can't breathe. Oh my God, House is really...
My mother used to call it. Find something.
Phenytoin?
Yeah.
That was really dramatic way to like pull out from his psyche what Dr. House needed to hear. He had to basically choke him to death by removing the oxygen around him. Was that always necessary? I should basically tell you what epilepsy is. It's overexcitability of the neurons, and they all fire at the same time, and that causes a seizure. So phenytoin decreases the neuronal membrane from the action potentials happening. Damn. That's intense.
He took phenytoin. That drug with the Epstein-Barr virus is associated with common variable immunodeficiency disease. T cells down, B cells down, keeps you from forming enough antibodies. See, the antibodies are basically your defensive line. And your brain is like the quarterback. And then the fungi are like blitzing linebackers, plunging up the middle. Your lungs are like...
I'm going to pause here and tell you guys that white blood cells all have different functions, and the B lymphocytes secrete immunoglobulins that help your immune system fight any diseases. He talked about CVID, which is common variable immunodeficiency, which means that sometimes people don't have those immunoglobulins to fight infections, and he's thinking maybe this patient has CVID.
Then he got the respiratory problem, and he tested positive for Epstein-Barr.
It's pretty much a childhood disease.
It's another reason why Chase's suggestion was idiotic. He got it when he was a kid. Didn't get any symptoms until now. It happens. It gets triggered by stress, like public speaking.
So you're basing your diagnosis on a virus that's relatively common and a drug he took 30 years ago.
Start the senator on IV immunoglobulin stat. If he gets better, I'm right. If he dies, you're right.
That's a great plan. I feel like giving someone IV immunoglobulins is not necessarily very harmful to do. It's a pretty low risk thing to do. And if it truly is CVID, then he'll get better.
Which means you can leave.
My son was right. I've tried for so long to protect him from... But I'm the one who's been selfish. This is no way for him to live.
Until we get an answer, it's the only way.
There is no answer.
There's always an answer.
Then what is it?
I love that he said there's always an
He's
answer.
been here 4 days. 3 suicide attempts.
Oh,
you don't have
my God,
an answer.
3 suicide attempts?
When I saw you, when I saw the cane, I thought, thank God, doctor will understand.
Oh, because he's sick too?
My husband thinks it's over. So look me in the eye. Tell me you'd want to live like that.
That's intense. I like
stabilize him. Get him in decent enough shape for the drive home.
She's an incredible actress. I like that she's not even...
Okay.
Oh, I feel like he had a moment of empathy in his... Oh God, that guy just scratched his crotch. Gross.
Testicles. What do they make you think
I love that dramatic entrance.
STDs, testosterone issues, that summer on Fire Island.
Oh, so close.
And they're all waiting
Correct
for him.
answer is epilepsy.
Epilepsy doesn't cause chronic pain.
It does if it spreads to the sensory region of the brain, then rewires the pain neurons.
Would have shown up on an EEG.
Not if the seizures are in a place you can't see on an EEG, a place too deep in the brain, like the area that controls the muscles supporting the...
Testicles.
That's far-fetched, but I suppose.
Feels like you got kicked in the nuts, doesn't it? The abdominal pain, how it all started. It wasn't the stomach. It was lower, right?
It's everywhere.
When it first started.
It's hard to characterize
Started
pain
in the
sometimes.
stomach. Cramps.
You know, like
For
bad
patients, you know?
gas or
For me, too.
permeating pain. Like your kidneys are being pulled out through your scrotum.
That's a great question of distinction, like gas pain or permeable pain, like your kidneys are being pulled out by the scrotum, because then you can understand how to answer it.
Because epilepsy is treatable.
Oh, yay! Epilepsy is treatable. Well, that's crazy. Far-fetched.
Some kind of religious conversion. She's practically salivating over
I'm
it.
just being candid about...
Well, so you don't think I'm scum? Just some committee thinks I'm scum.
But your lifestyle has risks.
You work around more sick people and germs and blood than I do.
Okay, he's
I'm
feeling
not gonna live my
judged.
life afraid like my parents did.
Oh.
Barely letting me play outside, and God forbid that I get a scratch.
Deeper childhood trauma
Calm down and
issues.
realize that this is
No, I won't. Why does everyone want to dictate the way I live my life?
Oh yeah,
the way we're
live
living
your
it is
life.
gonna kill you.
What's that mass? Gallstone?
Magnify times 5.
They're doing an endoscopic
That's not a gallstone.
retrograde cholangio pancreatogram.
I get a parasite.
ERCP.
Most likely through sexual activity, but we can't be sure.
And what's the treatment?
2 mebendazole pills.
I've also treated patients with parasites, but there's this whole like TikTok trend that like everyone has parasites. Like not everyone has parasites.
Those 2 pills is all I need. Once they're going to fluid.
Suction even getting on oxygen.
Damn, stirring up like crazy.
Patient's lungs are severely compromised. Liver's still failing.
Worms could easily have been a coincidence. Almost be surprising if he didn't have them.
Means it could be a hematological problem plus cardiomyopathy.
Nope. Neck veins are flat. Precordial exam was normal.
What if it's lymphoma? Peritoneal carcinomatosis explains liver failure. Paraneoplastic syndrome explains everything else.
Peritoneal carcinomatosis is basically caking of the omentum, which is the saran wrap layer of the abdomen. The cancer spreads to the omentum, or like the layer of the peritoneum. It's called peritoneal carcinomatosis, and it's one of the worst signs of cancer because it means like it's spreading fast.
Lymphoma it is.
He's peeing blood. BP's rising.
Alright, up to 250. He's going into cardiac arrest.
He lost his pulse. That's cardiac arrest.
Charging. Clear.
He's bleeding out.
He's completely giving out. Charging. Clear.
They're trying to electrically shock his heart back because at the end of the day, the heart is a muscle. And it needs to contract.
Do you want to nuke the patient's marrow? He had no evidence of being anemic or immune compromised when he was admitted.
Perfect white count as well.
Bone marrow is responsible for making white cells, red cells, and platelets. And so they're saying, why would you want to suppress his bone marrow when his white count and hemoglobin are normal?
Defenseless against an infection that could.
I'll come up with something better. You may as well die while we're treating him.
Guess you gotta take some risks when you don't.
Okay with you if I bring the other candidates in the loop now? Hayama here.
It's me and 13. Stop the ablation.
Oh, wait, stop the ablation. This is so dramatic.
Because?
Those threadworms. Why would his body have gone to hell just hours after they were gone?
The worms weren't hurting him. They were helping him. He has extraintestinal Crohn's. He got it from being raised in too clean, too overprotective of an environment.
It's the hygiene hypothesis. Why there's so much autoimmune disease in the developed world and almost none in the developing world.
The worms were keeping the Crohn's in check, teaching his immune system what it should have learned from eating dirt growing up.
Once you killed them, it started killing him.
I don't know if all
So
that's
his
true. That
life
sounds
of
amazing.
filth wasn't the problem. The clean living was. Let's start him on methylprednisolone.
And some helmets.
Worms. Cool, huh?
The immune system was being attacked by the parasites, but that was treating the patient because what he has is an autoimmune illness, extraintestinal manifestations of Crohn's disease. The parasites were attacking the immune system in such a way that the autoimmune illness wasn't attacking the body. So the parasites were in a way helping. That is so far-fetched. Let me just tell you right now. That's it for today. There's another episode coming your way next week. I am making content just for you and love to hear your reactions, comments, and stories to my sharing. In the meantime, own your health, own your future. Check out episode 12 of The Pit here.